Moving on to the muscles and the blood vessels of the lower arm, and while the blood vessels are nice and straightforward, there are a significant number of muscles that reside in the forearm, as well as muscles that are located in the upper arm but produce movement at the elbow and are therefore covered in this module. So we will begin with the muscles located in the upper arm, and these include the biceps brachii, brachialis, and brachioradialis, as well as triceps brachii. Brachial, which hopefully you remember from the last module, refers to the upper arm region and is why brachii or brachio are found in the names of each of these muscles. So on the anterior surface of the upper arm, we'll find the biceps brachii, the brachialis, and the brachioradialis. These muscles are all flexor muscles, which mean they flex the elbow and bring the hand up closer to the shoulder. The biceps brachii is the largest on the anterior surface of the upper arm, and as indicated by its name, so biceps brachii, it has two heads of origin, which both originate from the scapula. So we've got one head coming down here and the other head coming down here. The biceps brachii inserts onto the radial tuberosity, and alongside flexion of the elbow, it can also cause supination of the forearm, which is when your palms rotate to face upwards like you're holding a bowl of soup. The brachialis muscle sits deep to the biceps brachii muscle. You can see little bits poking out here and here. It's the most powerful of the elbow flexor muscles, and it originates on the anterior surface of the humerus and inserts down onto the ulna. The brachioradialis muscle originates on the lateral and the distal end of the humerus and then runs down along the forearm to insert onto the distal end of the radius. Although it is primarily running along the forearm, it does produce flexion at the elbow. On the posterior surface of the upper arm is the triceps brachii. So similar to the biceps brachii, as its name implies, the triceps has three heads of origin. So one from the scapula and two from the humerus. So we have 1, 2, and then 3 underneath here. The triceps brachii extends the elbow when it contracts, so it straightens your elbow. Moving on to the muscles of the forearm, and like the upper arm, the muscles on the anterior surface are flexor muscles, and these include palmaris longus, flexor carpi radialis, flexor carpi ulnaris, and flexor digitorum superficialis. As you can see, there's lots going on in the lower arm, and particularly on these flat images, it can all be a little bit confusing, but I'm going to show you how I identify these muscles, although there may be a different way that works for you. So first off, this muscle here, just for a bit of context, is our brachioradialis. So originating on the humerus and then running down along the radius to attach into that distal end here. Now from there, I like to identify the easiest or the most obvious muscle, and for me, that is palmaris longus. So palmaris longus is this muscle in here, and you can identify it from the way that it inserts into the fascia or the connective tissue of the palm. So palmaris longus, you're looking for it inserting into the fascia of the palm. So I find this fascia, I then follow it up along the tendon until I get to that muscle belly. Next, I determine which side of the forearm is my radial side and which side is my ulnar side. And we know that the radius is on the thumb side. So the next muscle across from palmaris longus towards the thumb is our flexor carpi radialis. So again, it causes flexion when the muscle contracts. It attaches into the carpals of the wrist and it's running down the radius. I then go back to my palmaris longus and now I'm moving towards my ulna, so the medial side. And this muscle is our flexor carpi ulnaris. So again, causing flexion when the muscle contracts. It inserts down onto the carpals of the wrist, but this time it's running along the ulna. We then have flexor digitorum superficialis, which you can see underneath here, here, and here. And now superficial would make you think that it would sit on top of all these muscles. However, it is actually just the most superficial of the muscles that flex the digits or the fingers, hence digitorum. So the confusing part is that we don't need you to know the muscles that sit underneath it. So you just have to remember that flexor digitorum superficialis is actually deep to the other muscles that we need you to know. Now, all of these muscles produce flexion. Palmaris longus and flexor carpi radialis and flexor carpi ulnaris produce flexion of the wrist. Flexor digitorum superficialis produces flexion of the wrist and also the fingers. Now, flexor carpi radialis can also produce wrist adduction, so it moves away from the midline of the body. Flexor carpi ulnaris can produce wrist adduction, so moving back down towards the midline of the body when the arm is in that anatomical reference position. Now, still on the anterior side, but we've taken a few layers of muscle over here on the right-hand side. And underneath our superficial flexors, we have three muscles that help pronate and supinate our forearm. And supination of the forearm is when you turn your palms to face upward, like you're holding a bowl of soup. Pronation is when you rotate your palms to face downward, like you're pouring that bowl of soup out. Now, the muscle that causes our forearm to supinate when it contracts is simply called the supinator, so that's nice and easy. The supinator originates on the lateral epicondyle of the humerus, and it inserts onto the proximal third of the radius, and it pulls this radius laterally to supinate the arm when it contracts. We then have this muscle here, which is called pronator teres, and it helps pronate the arm. It originates on the medial epicondyle of the humerus and then attaches onto the lateral surface of the radius, pulling that radius medially to pronate the arm. Now, this little rectangular section down here, which is partly hidden by all of these tendons, is called the pronator quadratus. So it also pronates the forearm, but it originates on the distal portion of the ulna and inserts onto the distal portion of the radius to produce this pronating movement closer to the wrist rather than up near the elbow like our pronator teres. Now, our final group of muscles form the posterior surface of the forearm and are collectively termed our extensors, as they produce extension of the wrist and or the fingers. And similar to my method on the anterior surface, I first like to locate the muscle which is easiest to identify. And for me, this is the extensor digitorum, because it originates on the lateral epicondyle, but then it splits into different tendons to insert into each of our digits or each of our fingers, hence digitorum. Now, on our little finger sides, which is now on this side because we've turned that forearm over, is our extensor carpi ulnaris. We come back to our extensor digitorum in the middle, and we then have our extensor carpi radialis longus and our thumb or our radius side, and our extensor carpi radialis brevis just sitting underneath it. So both of these muscles will extend the wrist. They both insert into the carpal bones, and they both run down the radius. However, the radialis longus has this longer tendon, which you can see running down along here. The extensor carpi radialis brevis has a shorter tendon, which you can see just underneath that, with brevis meaning brief or short. Now looking at the blood supply of the lower arm, and as I mentioned earlier, the vessels are pretty straightforward. We have a radial artery, which branches off the brachial artery to run along the lateral side of the forearm on top of the radius. We have a ulnar artery, which forms the other branch of the brachial artery and runs along the medial side of the forearm on top of the ulnar. Similarly, we have the radial and the ulnar veins, which drain blood from the palm and the forearms and run up the forearm on either side of the radial and the ulnar arteries. And then we have the median cubital vein, which is this superficial vein just running along here. It's often the vein that people will try and take blood from. It sits in the cubital fossa, which is kind of that indent or that depression on the anterior surface of your elbow. And it connects your cephalic and your basilic veins, which are these two superficial veins of the upper arm, but you're not actually required to learn for this unit. So all we want you to know is this vein that crosses over in that cubital fossa is your median cubital vein.